name is Phoenicia Jones, and I'm a Master of Health Informatics student here at Mercer University, Penfield College. And today I'll be presenting case study number 9, which is the Goodwill Healthcare Clinic's conversion to the EHR messaging system. And so just a little bit of background information about Goodwill. It is a clinical arm of the Jefferson Health Sciences Center, and it's also a clinical practice engagement for physicians. They have about 900 physicians there at Goodwill, and also about 2,000 employees, and there are 11 primary care and specialty units within the organization. They recently adopted a new EHR system about 2 years ago, and now they want to improve the quality of documentation in a call center in clinical use. Currently, they're using this system called the Lotus Note system. However, the problem is that the Lotus Note system is not, the notes that are input into the current note system is not accessed through the EHR system. Therefore, this presents a problem for the physicians and other healthcare providers who need the pertinent information regarding the patients. They can't access it in a timely manner, and this just leaves room for error in medical errors. And so the improper use of the implemented EHR system limits the quality, outcome, safety, efficiency, and productivity of the organization. And so here, this is the analysis of the key alternatives. And the first box includes the steps to a successful conversion. The second box, I have the makeup of the implementation team, which includes a physician, which will be the system champion, the IT manager, which will serve as the chair. It has a nurse manager, quality improvement director, and also the call center manager, which will represent as the project lead. Also, we do have some strategies listed to overcome resistance. We're going to really get to know the culture of the centralized call center, and not just the call center, but each unit itself as well. We'll do a key staff person engagement to kind of find those system champions out there to really motivate and push other employees at Goodwill to really adopt and engage in this new conversion messaging system. The standard procedures and policies across the organization will be one standard procedure and policy. The entire organization will operate in the same manner. That way we can eliminate any issues of other units doing things differently. We'll all be on one accord. And also the resolutions will be the implementation of the patient portal at a later date, which will also enhance cost efficiency and free up time within the workflow process. So the solution is to implement the messaging feature and prescription writing component of the current EHR system at Goodwill Healthcare Center across the entire organization. And so here you can find the implementation plan, which includes the workflow analysis, and which will evaluate the current process and procedures of the patient calls, identify opportunities for improvement as well. And then we'll do the system installation and determine the messaging and prescription configuration for the call center. Also, there will be staff training, and with the staff training, we will incorporate the training method, so their implementation team will be trained initially, and then they'll go out and train their respective departments. Also, we'll do conversion communications. We'll also have the go live preparations for when we do indeed set up their actual date to start using the implementation plan. And also the system maintenance procedures. And staff will be trained on these procedures as well. In conclusion, by implementing the messaging feature and prescription writing component of the current EHR and eliminating the current practice of using the Lotus Note system, Goodwill's centralized call center staff will help to improve the quality, outcomes, safety, efficiency, and productivity of the organization. With the involvement of key staff persons that represent the conversion team, all functions of the workflow process and considerations will be appropriately included. This current conversion will lay the foundation and path for additional features to be implemented within Goodwill's EHR system that will continue to move the organization to a higher level of efficiency and success. That will conclude my presentation. Thank you so much for watching.